Hello everyone. In today's episode we'll be talking about partograph, and then later on in the next video I'll be telling you about the modern partograph, that is WHO Labour Care Guide, and we'll compare both the traditional partograph and the Labour Care Guide. This is the WHO partograph which traditionally used to be plotted in the labor rooms. So you find this is the topmost column which talks about the patient details. So like registration number, name of the patient, her gravida, parity, date of admission, the gestational age, labor duration, all these things are plotted in the top. Then you have the fetal heart rate status. So the fetal status is plotted here. So every 30 minutes, the WHO partograph is started at 4 centimeters dilatation. So when the patient is 4 centimeters dilated, it is at that time that we start plotting the graph. Then fetal heart rate is taken every 30 minutes. So each box is of 30 minutes duration and the height of the box is 10 beats per minute. So you find that the fetal heart rate is normal between 110 to 160 beats per minute. If there is bradycardia or fetal tachycardia, then you can know at once. So every 30 minutes you will auscultate for the fetal heart rate. Then the per-vaginal examinations. PV examinations are done every 4 hours. So after every 8 squares, that is each square is for 30 minutes. So after every 8 square, that is after 4 hours, you will do a per-vaginal examination and you will look for the color of the liquor or molding. If the membranes are intact and there is no liquor visible, then you will write N, that is no liquor. If the membranes are ruptured, then you have to comment upon the color of the liquor. If it is clear, like in this case, it is written C. If it is meconium stained, we will write M. If it is blood stained, we will write B. And so these are the findings. Then comes molding. Molding has to be graded such that if there is no molding, that is the bones are not overlapping each other on PV examination, then you grade it at 0. Then it can be +1, +2 and +3. +1 is the bones are touching each other but there is no overlapping. Grade 2 is, that is plus is, the bones are overlapping each other during contractions, but during relaxation phase the bones are that is the skull bones are going apart. And in grade 3 molding, the bones are overlapping and during relaxation also they are overlapping. So it signifies cephalopelvic disproportion. So these are all the fetal findings which are done. If PV finding is repeated before 4 hours, then you have to mention it with reason why you have repeated. If there is rupture of membranes or due to other reason, if you have repeated the per-vaginal examination, then you have to tell. Then comes the maternal parameters. In maternal parameters, you have to plot the descent of the fetal head along with the cervical dilatation. So you find there are two lines. One is the alert line and one is the action line. So initially when the WHO partograph was initially designed by Friedman in 1954, then there was no concept of alert line or action line. But in 1972, this alert and action line was then initiated. This is because the idea was that the cervical dilatation should be at least 1 centimeter per hour. If it is slower than that, then there is chance of dystocia, that is abnormal labor. So you have to be alert. And if the dilatation is more than if it is slower than 4 hours, that is to the right hand side of the alert line at 4 hours duration, you have the action line. So if it crosses the action line, then you have to take an action. You have to either augment the labor or you have to go for cesarean section. So you can find in this graph, what we did is we plotted the cervical dilatation against time and we found that the cervical dilatation is to the left of the alert line. So this means cervical dilatation is proper. It is more than 1 centimeter per hour and the head descent is also plotted. So by the time the patient has become fully dilated, that is 10 centimeters, the descent has also taken place and the head station has gone to 0. And then patient had a normal vaginal delivery. We have to write it is a female baby, 3.2 kg, and the time and all. Now contractions are also plotted. Contractions are plotted such that you have mild, moderate and severe contractions. Mild contraction is that one contraction lasting for less than 20 seconds. Moderate contraction is one contraction lasting for 20 to 40 seconds. And severe contraction is when it lasts more than 40 seconds. When it lasts more than 1 minute, that is 60 seconds, you tell it as hyperstimulation. So if there is hyperstimulation, you have to give IV fluids and then stabilize the patient. So if there is mild contraction, you have to plot it with dots in the squares and number of contractions in 10 minutes. So for 10 minutes, you will keep your hand on the fundus of the uterus and check how many contractions are there and each contraction lasting for how many seconds. So if it is less than 20 seconds, then you plot it with dot. If it is between 20 to 40 seconds, that is moderate contraction, you plot it with lines. And if it is severe contraction, then you color the squares. So number of contractions also is shown per 10 minutes and the intensity also. Then the below that you have the drugs and IV fluids. So whatever IV fluids, if you are giving ringalactate or NS, or you are giving any drugs like drotin, epidocin for dilatation, these all you have to chart. Then finally you have the mother's blood pressure and pulse rate, that you have to chart. So the pulse rate is charted with a dot and blood pressure is charted with a vertical line, as you can see over here. So this is the dot which we are putting and we are joining the dots so that you get the pulse rate, and blood pressure is charted such that the lower and upper the systolic and diastolic blood pressures are taken and it has to be marked with a line. So every time you will mark with a line. Then below you have the temperature and urine amount, protein and acetone. Protein is urine albumin. In case of hypertension it is important, and acetone is ketones. So urine ketones is important in case of diabetes. So this partograph, if you are asked in examination, you will have to describe it like this, and there is proper dilatation and descent of the head, thereby leading to normal vaginal delivery. Now come to the second partograph. This type of partograph is also asked in examination. So here again you will describe everything and finally you can interpret it. You can see the cervical dilatation. Now you see this is the cervical dilatation which has been marked by this chart. So this cervical dilatation has started from 4 centimeters and there is very slow progress of the patient. See this 4 to 5 centimeter, it took around 2 hours to go, and then it went to 6 centimeters dilatation. Then after that, of course, it is to the right of the alert line, but it has not crossed the action line. So then finally what happened at this place, ARM was done. ARM is rupture of membrane, artificial rupture of membrane was done. And after artificial rupture of membrane, it is a method of augmentation of labor. So the oxytocin has been released naturally, and that has led to augmentation of labor and then labor progress properly. So when the cervical dilatation has touched the action line, we had taken an action, we had done an ARM because the cervix was almost 6 centimeters dilated. After the rupture of membranes, the progress of labor was good enough and there was cervical head descent, and so baby delivered by normal vaginal delivery. Contractions also developed after the ARM was done. So this is how we take action when it touches the action line. Now check this partograph. In this partograph, the fetal heart rate was initially normal, but the cervical dilatation was not good. Cervical dilatation was continuing and it has crossed the alert line and finally it has crossed the action line. So when it has crossed the action line, ARM was done for the patient, that is artificial rupture of membrane was done, and at that time, that is at this moment, you find that liquor was clear. But then after about 1.5 hours, patient had grade 4 molding and there was meconium stained liquor present. Fetal heart rate was also dipping. It has gone to less than 110 beats per minute. So fetal heart rate there was deceleration, and so because of which the per vaginal examination was repeated before 4 hours, and we find that there was MSL, meconium stained liquor, and cervical dilatation was also not taking place properly because it has crossed the action line. Fetal head descent was also not taking place despite adequate contractions. So we had to take the patient for a lower segment cesarean section, and she delivered a female healthy baby. So this is how we can take appropriate action at time, and we can do a cesarean section or normal vaginal delivery. And finally, this partograph I want to show. Now in this partograph, the same thing, fetal heart rate was initially normal, and the progress of labor has crossed the alert line, but it has not crossed the action line. But what we did is, since contractions were taking place better and 4 hours were over, we conducted a per vaginal examination, and she was almost 8 centimeters dilated. At that time an ARM was done, rupture of membranes was done, and there was thick meconium, grade 3 meconium. Fetal head descent was at -1 station, of course, but the fetal heart rate has dipped very much below, that is at 80 beats per minute, and it was persistent at that. So at that time a decision was taken for cesarean section, that is despite adequate contractions. There were 4 contractions in 10 minutes and all were severe intensity, but still there was no proper head descent, and there was grade 3 meconium stained liquor. So a cesarean section was done. So this is how partograph helps in taking action at the appropriate time. So alert line and action line is what you have to check. So in my next video, I'll be talking about the WHO labor care guide. Now this labor care guide is nowadays used in labor room. This initial partograph is generally not used. So we'll compare both of that.